Let's now move on to the numbers from Delhi. 12,651 new cases have been reported in the national capital. 319 deaths have been reported in the last 24 hours. So obviously no government or no organization is going to break into celebrations just yet, but this is a mild dip from the peaks that we saw last week. Should we be starting to notice this as a trend? Is this the effect of the lockdown? We do not know. This is the lowest, by the way, since the 12th of April. 11,491 new cases were reported, remember, on the 12th of April. The positivity rate has gone down below 20%. So that is being seen as a positive sign, which is the lowest since the 14th of April. But, and this is very, very important, remember, Delhi is in a state of a lockdown. For the fourth consecutive week, it is in a state of lockdown. When you lock down, you are restricting people from gathering. So if post these numbers, we were to lift the lockdown, will that have an impact on the number of cases? These are questions which are of utmost concern and worry for the state government. Let's listen in to what Arvind Kejriwal had to say.
वैक्सीन 3-4 दिन की और बची हुई है, सप्लाई कम है, कंपनियों को हमने ऑर्डर प्लेस कर दिए, लेकिन जो हमारा मानना है कि केंद्र सरकार इसका आवंटन कर रही है, क्योंकि केंद्र सरकार से चिट्ठी आती है हमारे पास कि आपको इस महीने इतनी मिलेगी, इस महीने इतनी मिलेगी। केंद्र सरकार से मेरा निवेदन है कि हमें ज्यादा से ज्यादा वैक्सीन दी जाए। हमें तैयारियां करनी चाहिए, तीसरी लहर की बिल्कुल तैयारी करनी चाहिए। एक और हमें अपना ये जो इंफ्रास्ट्रक्चर है इसको और एक्सपेंड करना पड़ेगा। ये जो लहर आई इसमें 28,000 केस आए हैं मैक्सिमम, मतलब बियॉन्ड सारे कैपेबिलिटीज, जिसकी वजह से बहुत ज्यादा पूरा इंफ्रास्ट्रक्चर तनाव में आ गया था। लेकिन अब हम जिस स्केल के ऊपर इंफ्रास्ट्रक्चर क्रिएट कर रहे हैं, हमें हफ्ते 10 दिन लग गए, लेकिन अब जिस स्केल के ऊपर हम कर रहे हैं, अगर अगली लहर में 30,000 केस भी आते हैं तो हम उसको डील करने के लिए तैयार हैं।
And Arvind Gunashekhar now joins us with all the latest. Arvind, of course, there is this dip in the positivity rate. However, everybody is trudging cautiously. On the other hand, is the whole point on faster vaccination. And to that extent, the Delhi government feels that they don't have enough vaccines to vaccinate people. Arvind, can you hear me?
Yeah, Sanket, if you could check the Delhi data that has been made public by the Delhi government now, in the last 24 hours, almost over 12,000 cases have been reported across the national capital. The exact figure is 12,651 cases. If you could check the number of tests that have been conducted, in the last 24 hours, it's somewhere around 66,234. Though the tests have come down considerably when you compare it with the April 2nd or 3rd week, but what explanation the Delhi government officials are saying is that during the April 2nd or 3rd week, there was no lockdown and almost 25,000 to 30,000 tests were conducted at the marketplaces. But because all the markets are shut, because lockdown is enforced, that's why those 30,000 tests are not being conducted, and that's why the test numbers are somewhere between 60 to 70,000. That's their explanation. When we ask them whether because the number of tests is coming down, that is reflecting in the number of positive cases also coming down forward, what they are saying is that that's not the case. If that is the case, then the positivity rate might not come down. If the infection rate is higher, then that will be reflecting in the positivity rate. Because the positivity rate from almost 30%, it has come to 19% now. That's a sign that things are actually improving on ground in the national capital. So that's where the government officials, the health government officials of the Delhi government are very much confident that things are actually improving in the national capital because of the lockdown, and the lockdown is actually yielding results. Another cause of worry in this entire data is the number of deaths. Look at the number of deaths. Almost 319 people have succumbed to the infection in last 24 hours. If you could check the yesterday's data, it's somewhere around 273 people. So the fatality rate is still higher when you compare it with other states in the country. Correct. But the positive cases is coming down. That's a good sign. But the government is looking for interventions to reduce the fatality rate also.
And also, Arvind, one must not read too much into this, because remember, Delhi is in a state of lockdown. So once the lockdown is lifted and people start their congregation, then what will happen to these this dip in cases? There is every possibility of this increasing. So you can't let your guard down. But Arvind, the other big point, which is a big point of concern for the whole of the country and highlighted by Delhi, is the fact that there are very limited number of vaccines available. What did the Delhi government say?
Yeah, Sanket, because vaccine is the only solution we have in our hand to fight this pandemic. We have to vaccinate as large people as possible in order to tide over this pandemic, tide over this crisis. So, as a double whammy, what we are facing now is a shortage of vaccine also. Today, we went to some of the hospitals in the Noida, which again comes under the NCT, National Capital Region. When we went there, today is the first day in UP where the vaccination for 18 plus is starting. But what we saw there was utter chaos, confusion there, because hardly 200 slots were available at the hospitals, whereas more than 400 to 500 people have arrived at the hospital for vaccination. That's the case at Noida. That's not the case alone at Noida. That's the case in the national capital also. Even the Delhi government is also saying that they had asked for vaccination. They have asked for more vaccines from both the companies, but the allocation, though they asked for the vaccines in crores, but the allocation is still in lakhs. That's the case in Delhi. That's the same case in Bangalore, Karnataka also. What we are hearing is that the government might take a decision to suspend the vaccination for above 18 plus only because of the shortage of vaccine. They want to cater the above 45 age region in Karnataka. Similar reason what we are hearing from Tamil Nadu also. So shortage of vaccine is actually going against our fight against this pandemic. Thank you.